Is the immunization schedule different for premature babies? This is a great question that many parents of premature infants may have. The immunization schedule for premature babies is generally based on their chronological age, which is the time since birth, rather than their gestational age, which is how early they were born. This means that even if a baby is born several weeks early, they will still start receiving vaccines according to their actual birth date. Premature babies, defined as those born before 37 weeks of gestation, are at a higher risk for infections and complications from diseases that vaccines can prevent. Because of this increased risk, timely immunization is very important. Major health authorities, including the Centers for Disease Control and Prevention and the American Academy of Pediatrics, recommend starting vaccinations based on the infant's chronological age. For example, if a baby is born 8 weeks early, they should receive their first vaccines at 2 months after birth, not at 4 months after their due date. Delaying vaccinations can leave these vulnerable infants open to infections. That said, there are some vaccines that may need special consideration for premature infants. For instance, the Hepatitis B vaccine might be delayed for very low birth weight or extremely premature infants. In such cases, the first dose may be given when the infant is discharged from the hospital or reaches a certain weight, depending on the healthcare provider's judgment. Additionally, premature infants may receive preventive treatments for Respiratory Syncytial Virus, also known as RSV. This is not a vaccine but an antibody therapy that helps protect against this serious virus. It is also important to note that healthcare providers may monitor premature infants more closely after vaccinations to watch for any adverse effects. However, vaccines are generally safe and well tolerated. In summary, while the timing of immunizations for premature babies follows the same chronological schedule as for full-term infants, healthcare providers may adjust specific vaccine administration based on the infant's health and weight. Parents of premature infants should consult their pediatrician or neonatologist to ensure that their child's immunization plan is appropriate and timely. This is crucial for protecting their child from infectious diseases. Following established guidelines helps ensure that premature infants receive the protection they need without unnecessary delays.